Welcome to the Currents of Public Health webinar series presented by the School of Public Health at Georgia State University. My name is Brian Greer and I'm the Director of Development for the School of Public Health. The goal of this series is to explore relevant public health topics with members of our community. Today's topic is global and local perspectives on water, sanitation and hygiene, and health. Our guest is Dr. Christine Stauber, who is an Associate Professor of Environmental Health and Associate Chair for the Department of Population Health Sciences in the School of Public Health at Georgia State University. Dr. Stauber received her PhD in environmental science from the Gillings School of Global Public Health at the University of North Carolina at Chapel Hill and has over 15 years of experience in environmental health sciences. For 2 decades, Dr. Stauber has worked on international issues and has been the recipient of multiple international awards, including a Faculty Fulbright Award to Brazil. The overall theme of her research is the examination of environmental exposures in resource-limited settings. The majority of this work has focused on the pivotal role of exposure to microbiologically contaminated drinking water and the associated health impact on children. Dr. Stauber teaches graduate level courses in environmental health, including courses on the role of the public health laboratory and global water issues. She also leads a study abroad course examining collective health, race, and culture in Salvador, Brazil, where she studied both as a student and a faculty member. Today's webinar will be guided by 3 general questions. What are you doing? Why is it important? And how can we get involved? Quick note, if you have a question at any point during our conversation, please feel free to type it in the Q&A box and we will try our best to answer. So let's begin. Dr. Stauber, welcome to the webinar. If you would, please tell us about your research, what you're doing, and why is it so important?
Thank you, Brian. I'm excited to be here and to share my work. I'm very passionate about it. And I thought I would start off by reading a couple of quotes. And so the first quote says, "Children playing feet away from open pools of raw sewage, drinking water pumped beside cracked pipes of untreated waste, human feces flushed back into kitchen sinks and bathtubs whenever the rains come. People testing positive for hookworm, an intestinal parasite that thrives on extreme poverty." The second quote, "Before the sun rose this morning, Chilakila Ogletree had water on her mind. As she did most mornings, she poured gallons of water into a large pot, warmed it up on the stove, and dumped the water into a pair of plastic storage tubs filled with soap. After calling one of her granddaughters into the kitchen, Chilakila washed the parts of her back she couldn't reach. Once that grandchild dried off, Chilakila had the next grandchild in line climb into the second tub. Chilakila, meanwhile, scrubbed down the first tub so that her other 2 school-bound grandchildren could get clean. All this had to be done before the bus pulled up outside at 7:10 a.m. To get this done, Chilakila purchased bottled water from the store, not because she wanted to, but because she had no other choice. Her house has no running water." And when I read these quotes, I think about experiences that sound very far away from my own experience with regards to access to sanitation or water. And I think sometimes that feels far away, meaning other parts of the world. But it could also mean far away from just my personal experience and what I take for granted, which is when I turn the faucet on, I get clean water and I can easily flush my toilet and know that those things go away from me and become someone else's problem. But the reality is that these situations are not far from us. The first situation describes a situation in Alabama, in Lowndes County, where a study found that parasitic disease that thrives in areas of poverty was rampant. And it found that communities in this area have what's called straight pipes from their home. They don't have access to any kind of sanitation that we would consider necessary to protect us from disease. They don't have the resources or the environment that fits the sanitation needs that many might use, like a septic tank. They don't work in this area of Alabama. It's not the right kind of setting for septic tanks to function. And certainly very, very hard to get something like pipe sewerage into these communities. And so the reality is that people face very devastating consequences with access to water and sanitation in the United States, even though my personal experience and the majority of us are not facing these. The second quote is actually even closer to home. It's a story from a news blog post called The Bitter Southerner, called The Weight of Water. And this is about, especially prior to the pandemic, although it's going to start happening again, this family that didn't have water because they couldn't pay their water bills. And the reality is that utility costs drive choices that people have to make. And ultimately, she's paying a lot more per liter or gallon of water than we all are. But when utility costs drive choices like no access to water in a home, it has dramatic impacts. And I think the talk that we heard earlier this week in Grand Rounds about structural racism is really alive and well in the United States in many of the sort of very disparate outcomes that we see for water and sanitation. But of course, my talk is going to be talking sort of more globally and then talking about some local perspectives. So today, I just want to sort of remind everyone some of the major things that we're concerned about with related to diseases and illness associated with water, sanitation, and hygiene, the work I've done in this field, and then what I hope to be doing in the future. This is just going to be a vignette. So what we know is that globally, water and sanitation and lack of access to these caused major illnesses, primarily in children under 5, for many, many years. And in the 1980s, the world said, we need to change this. And they set about to really improve access to safe drinking water and sanitation. And there have been major improvements since the 1990s when that we've been starting to measure these very well. And with the Millennium Development Goals and now the Sustainable Development Goals, we're documenting access to water, we're documenting major improvements in child health. But these remain major burdens of disease globally. And they account for almost all 5% of all disease and 3% of all deaths. And of course, children under 5 are most at risk from the conditions that impact communities when they don't have adequate water for drinking or bathing or sanitation. Of course, regions of the world have areas where there's very low levels of access, particularly countries in parts of Africa that are considered sub-Saharan Africa, where the burden is the greatest. But the United States also faces disparities in access to these services. This was an article in the journal Nature, where researchers did their best to assess the percentage of households with incomplete plumbing in the United States, which includes not having access to hot and cold water, a sink with a faucet, a bath, shower, or a toilet. And this is the definition of incomplete plumbing. And you can see there are major regions in the United States that don't even have complete plumbing in their homes. That can be certainly, again, if we think about the structural historical components to racism in the country that could be linked to these conditions. My work in water, sanitation, and hygiene has focused primarily on the role of microbiologically contaminated drinking water and its health impact. I'm frequently building collaborations, both with others in locations where I work and with community, to deliver stronger impacts to the research that I do. I use both experimental and observational design in our laboratory here at Georgia State and in the field. And I've done research in a variety of settings, both locally, nationally, and globally. So in the next couple slides, I'll give you a little bit more detail about my work and what I'm currently doing. There are 3 key areas that I've been talking about. One is really developing and evaluating low-cost methods to measure microorganisms in environmental waters and other media. This is important when we think about needing to broaden access to understanding where these microorganisms are and what their potential exposures and who could be exposed to them is. The second is having a better understanding about what exposure to those microorganisms means for health, primarily health related to infectious diseases such as diarrheal disease in children. And then the other part of my work has really been to sort of understand the dramatic disparities that we see in this context. If we look more broadly, I've broken it into really a framework. We're looking to measure environmental contamination in water, in other environments, could be on surfaces of toys. We're looking to understand how we treat or remove those microbes from those environmental conditions. And then separately or in concert, looking at what the health impacts are through epidemiologic studies using randomized controlled trials or observational, cross-sectional, or cohort studies. And ultimately trying to understand the challenges facing those made most vulnerable by these disparities and the conditions that they're facing. How do we understand that? How do we know the impacts of that, which are happening different across different groups? So for this talk, I'm just going to focus on a couple of things that I've been doing nationally or locally, where we'll be looking at how we've examined health effects and documented disparities. The first is a collaboration with colleagues at the University of Alabama in Tuscaloosa, which we did about 8 years ago, where we were looking at that same region where I talked about in the beginning, the region of Alabama where it's very difficult to access water and sanitation facilities. And we looked at households that were being served by small rural water supply, like locally municipal wells in regions of Alabama in Hale, Sumter, and Wilcox counties. We did a cross-sectional study where we looked at reported measures of access. We looked at water quality. We looked at perceived taste and odor issues. We measured pressure. We asked about whether or not their service went out. And we also looked at health effects. And in this table, you can see out of the 910 households in this region, many replied that they had intermittent service, almost 5% monthly, high levels of objectionable taste and odor issues. And we also measured low water pressure in these households. Separately, in that same study, we went to the water utilities and took samples at various points in the water distribution system. So we looked, all of these small rural water supplies in this region of Alabama were using wells. And so we looked at water right at the well. We looked at water after it was treated, as it was being stored and then sent out to customers, both in the distribution line and at the end of the distribution line. And this graph looks at heterotrophic plate count, which is a measure of total quantity of a certain type of bacteria. What we found was that the contaminants, the potential for contamination varied throughout these water utilities, but that consumers who reported low water pressure, we were able to measure it, and it was associated with increased reports of gastrointestinal illness. And prior to the work that I shared with you in Lowndes County, even in our set of 900 households who have pipe water supply, 5% of them didn't have any reported sanitation system. So they had a straight pipe that left their home and went to a creek or outside of their house. So this is a major area that's increasingly understood sanitation issues in the United States. And then the work that we did here in Atlanta was the work of Nataki Osborne-Jelk's dissertation work, which was a community engaged research project in the Proctor Creek watershed. It included a variety of activities, but one of them was a participatory mapping approach where watershed researchers were asked to develop key things they wanted to map and document in their community. What were some stressors that they identified and prioritized? And they built together with students in the geosciences department an app where they went around and mapped these concerns. And what you can see was one of the major concerns was illegal dumping, stormwater drains that were broken, standing water. And the community mapping project allowed us to visualize essentially key areas where this was occurring in the community. And as we know, this watershed is not isolated from other waters. So dumping on this land then leads to contamination, not only in the Proctor Creek, but also the rivers that it feeds into, like the Chattahoochee River. And so this was a really important way to document that these are hazards that are going on that were important to the community and likely having an impact both on the recreational waters in their community, as well as potential impacts for things like exposure to contaminants and drinking water. This other part of the work that Nataki led for her dissertation was a photo voice activity where the community researchers documented what water meant in their community in this watershed. And in this particular picture, it was showing how many times houses would get flooded that were nearby the creek. And that's a huge danger, right? Mold and mildew inside, other potential hazards that could exacerbate existing health conditions. So currently, I'm actively engaged in a couple of key areas. One is how can we use wastewater to understand community levels of disease? We were doing this work prior to COVID-19, and we've been focused on this for the role of Zika virus, which is in collaboration with my colleagues in Brazil. But really the idea has been, greatly expanded during COVID, where we can start to take community collective samples of sewage and start to understand what diseases are circulating. This work is not brand new. This has been being used for a number of years to understand community contributions to infectious diseases such as polio that can be transmitted via water and sanitation issues, but other diseases where we don't think the main route of disease transmission, like COVID, is not mainly transmitted through access to contaminated water, it still provides an important tool in our epidemiologic toolkit to start to grow and understand. So I'm working on that. I'm also building collaborations to understand how we can enhance the role of mobile health in WASH. As you see in our work with the mapping, that's one tool, but there are lots of ways to start to integrate mobile health measures into water and sanitation. And then ultimately, one of the things that I'm starting to get interested in is the role of what water insecurity may be acute, like we see in places where we're under a boil water advisory for a day or 2 days, or long-term water insecurity, which is really driving a lot of questions more broadly. What's happening in terms of water? Many people have said water is going to be our major issue for the next 50 years or beyond. And so thinking about what water insecurity does, how it has a broad impact both globally, and then thinking more acutely about what happens when people experience boil water advisories, or we have poor water quality that force people to make choices like we see in places like Jackson, Mississippi, which prior to their major air flooding and water supply issues, they were having chronic challenges with their water supply. So lastly, I'll say, and I've done this kind of quickly, I'm deeply committed to mentoring and training graduate and undergraduate students, and inside and outside of the classroom. So here you can see a couple of students that had gone on a trip to Brazil with me, both got Fulbrights and, pursuing additional international experiences. And the way that I support them outside of the classroom is to, encourage them to apply for these things, support them through writing letters of recommendation, that they're the reasons they got these awards, but it's, being there to say, this is something you should consider. And that's a key role that I think beyond research that I have. So with that, I'll stop and open it for questions. I have, a little bit more I can share as we talk through these key questions that you have.
Yeah. And yes, for our attendees, please, if you have any questions, you can put them in the Q&A and we will get to them. I do want to follow up, and I appreciate the presentation, and it's very topical and very important to have these discussions. And I'm just wondering, as a community of people concerned about public health and concerned about this issue, how can we become advocates for your work?
I think, one thing I would say is that we have to stop ignoring the cost of water and sanitation. I think we take it for granted. I'm not sure how many people know where their water comes from or where their waste goes, but thinking more critically about it and what it means and being advocates for resources to support it. I think, making sure that we're thinking about these beyond, like, the well, it's not really impacting me, but I think ultimately these are questions that are going to continue to impact us, and starting to think about, like, what does this mean? What does access to water really mean? How can I really think more critically about this? Where, thinking more critically about where you get the water from, what you value in it, and putting more value on these systems that most of the time in the United States function well for a large majority of us. So thinking more critically about not taking those for granted, and understanding a little bit more about those and what impacts they have on our I think water is essential for life, and it's maybe sometimes too easy to forget that.
Yeah. And I have a question from the audience, which is a good one. Has your research helped any policy responses to address this vital public health issue?
Well, I mean, yes, and I will say that some of our early work was really to allow for tools beyond pipe drinking water, to allow people to move from very unsafe water to better quality water. And some of that work was what we call household water treatment, where we're asking governments and major health organizations like the World Health Organization to recognize this as a tool. It's not perfect. It's a step in the ladder to make these improvements. But if you could boil your drinking water before you consume it, you're likely going to reduce your risk of diarrheal disease. If you could filter it, it doesn't mean that people should stop advocating for getting access to pipe water, but there are some ways that my early work has helped sort of inform that. And then separately, I was on a National Academy of Sciences committee where we looked at New York City water supply and what they were doing to protect the population. And that was a really very important and interesting experience, where we got to really think critically about what the city itself has to choose in terms of protecting its population through its water supply, and making recommendations for how they can continue to do that.
I have another audience question. Could you enlarge a bit on the quantitative relationship between wastewater viruses, for example, polio or COVID, and disease transmission?
Sure. There's a lot to learn about it, but I think we've seen often in the COVID pandemic that, weeks prior to a surge in clinically detected cases, we'll start to see an increase in viral RNA in the wastewater. And so it can help us prepare better. I think if we could start sampling and looking for a broader range of diseases, we might know, hey, things are circulating before they're actually being clinically detected. This is really important for diseases that are asymptomatic, but people are shedding in their feces, in their urine, in large enough quantities that we can see the RNA, we can see changes. It's a complex relationship. It's too much to go into detail here, but I think the monitoring that they were doing in New York City allowed them to understand that polio is circulating there basically undetected, and they needed to reach out and do some vaccination campaigns because of it.
Interesting. Another question from the audience. What do you see as the #1 priority that needs attention to address this issue?
Well, I think we need to advocate for resources that we should be thinking about, access issues in the United States. I think the federal government has made major investments in water and sanitation through the Environmental Protection Agency, but those were decades ago. And maybe with this Infrastructure Act as one step towards meeting those needs. But if we look at what happened in Flint, there's billions of dollars that need to be spent to replace lead in pipes, and we have to figure out, as a society, are we willing to pay for that? And I think, being more advocates for it, being aware of it, and, I think it can be really a silent issue if we're not faced with a crisis. So I think being more aware and understanding that, these systems are functioning, but they need support. And many times they're hundreds of years old, or, 100 years old, and that's too old. We have to start putting money towards it. So, I think climate change is a major issue that's impacting this and will continue to impact these questions. And we're seeing drought in the southwestern United States like we've never seen before. We're going to continue to face these issues. So thinking about, how this climate change is making these conditions worse is also important.
And can you elaborate on that a little bit? Are there any other threats as a result of climate change that you see?
I mean, there's a ton of opportunity to link a lot of the environmental concerns that we have to climate change. Certainly water scarcity and water security are key issues. The others are probably more related to what we do during emergencies and, where we're seeing increased flooding, both catastrophic flooding, but then short-term issues, right? That might, if we think about the situation in Jackson, Mississippi, it was kind of a short-term flooding, not like anything we saw during the other hurricane or the major storm that happened in Florida, but yet very disruptive to people's lives. And so I think we're going to continue to see weather impact access to these. And, primarily what people can do, at least immediately, is make sure they're prepared to weather a boil water advisory or a storm by making sure you have access to safe drinking water in your house. I mean, certainly that's a major concern that, immediately you could go out and make sure you have an emergency supply kit. But broadly, I think we need to be thinking about how we make our water infrastructure and sewer infrastructure more resilient.
And I have one more audience question. Is there any statistical data available that helps quantify the disparities faced by disproportionately affected populations? And then how can we visualize the level of needs we face?
Well, I mean, I think there was a report to the special rapporteur to the UN came to the United States and did an analysis of how we're really doing on water and sanitation, because our global statistics aren't going to show it. And as you saw from that graph, it's pockets, right? It's not everyone. It's not my experience. So I think that's a good place to start with this report that the global rapporteur wrote. And she talked about all of these issues like cost, right? The cost of utilities and what families are facing, and I think that's probably, that's a good place to start. And beyond that, there's a lot of literature expanding that. We haven't talked at all about what homeless populations do in terms of access to water and sanitation. A colleague of mine had a student that went around Atlanta and found human feces, right? We know that the homeless population doesn't have these services. So I could go on and on about that, but I think that, the article, the report on how the US is doing, that was written by the special rapporteur to the UN for the human right to water is a good place to start.
So my final question, where do you see your research in the next 3 to 5 years?
Okay, well, so I did have this, but I'll just come back to it if we have a moment. I'm really working to build our capacity in the lab to do digital PCR, which is PCR is the way that you detect nucleic acids. This is something I think our students could be learning and then perhaps be participating in research and training in the National Wastewater Surveillance Program. I'm also interested in expanding this work on wastewater-based epidemiology, primarily in Brazil, because I'm interested in looking perhaps at non-COVID related, not COVID. COVID's a very crowded field right now, but arboviruses is one that I think we could start to be thinking about more. And then I'm really starting to delve more deeply into the role of boil water advisories, what they mean, how they're related to climate change and sort of acute water insecurity, and looking at what we know, because water utilities don't have to report those. They're not a reportable, unless they're violating one of the criteria and pollutants for the Safe Drinking Water Act. So that's those are the places that I'm going, working to explore and research and training for our students.
And really quick, I think we have just one more minute. Can you share about your work in Brazil and the study abroad?
Yeah, so we've been doing this program for 6 years. We've had almost 70 students go on the program. We went in July 22. It was great to go back. We had 2 years where we're doing it virtually. It's a wonderful program. We have amazing partners. We explore both culture and race, and then of course this idea of collective health, which we are trying to understand, is it the same as public health or not? So I'll be happy to send me an email if you want any more information. My email address is here about this or all the other stuff I've talked about today.
Excellent. Well, I want to thank you for sharing with us today, Dr. Stauber. This has been very informative, and I appreciate the conversation, appreciate the great work that you're doing. And I want to thank our attendees for attending the the webinar today. In closing, the School of Public Health at Georgia State University is one of the most diverse schools of public health in the nation, offering a Bachelor of Science in Public Health, a graduate certificate, a Master of Public Health degree in 6 concentrations, and a PhD in 4 public health areas of knowledge, and a Doctor of Public Health. The faculty and students conduct research on the complex public health challenges facing cities across the globe. Our work is often carried out in partnership with communities, their residents, and community-based organizations committed to health equity. If you'd like more information about our programs or how to support the work of the school and our students, as you've seen today, please visit publichealth.gsu.edu. So thank you again to Dr. Stauber, and thank you all for attending. Please join us for our next webinar on Thursday, November the 10th at 12 p.m. featuring Dr. Kimberly Freyer, who is a clinical associate professor in the and Behavioral Sciences Department at the School of Public Health. Thank you all again, and we will see you next time.